Some patients who are diagnosed with multiple myeloma do not show any symptoms. They may be classified as having smoldering multiple myeloma or asymptomatic multiple myeloma. At this stage, the disease may not progress for months or even years. These patients are generally monitored carefully, and doctors wait to begin treatment until symptoms appear. When you begin to have symptoms, the type of treatment you receive is based on a number of considerations. These include your age and general health, your disease stage, your symptoms, and your test results, including renal function and blood tests, which can help to determine how your body's makeup might respond to a particular treatment. There are a number of therapies that have been shown to be effective in treating multiple myeloma. Your treatment will be custom-tailored to your specific case. You could have multiple treatments over the course of your disease, and you may even receive one or more stem cell transplants. This is because it's common for patients having treatment for multiple myeloma to relapse or have the symptoms of the disease return. Patients may also become refractory, which means that they no longer respond to a treatment and the disease reappears. Despite recent progress, multiple myeloma is still considered an incurable disease. However, it is treatable. Open communication between you and your doctor will help in tailoring your treatment to your needs and ensure the best possible care for you at each stage of your disease. You should learn to recognize and report any side effects you experience with treatment as soon as possible, because this may help your doctor to better manage them and reduce the potential for more serious side effects. Now, you'll learn more about your treatment options. Anti-myeloma therapy uses anti-cancer drugs taken by mouth or in a vein in an attempt to destroy myeloma cells. The usual treatment may consist of at least 2 drugs used together. Drugs, when used in combination, have proven successful in treating myeloma and extending patients' lives. The drugs are often given in cycles with a rest period following the treatment. The choice and dose of drug therapy depend on many factors, including the stage of the cancer, the age of the patient, and how well they respond to the drugs. A class of drugs called bisphosphonates may also be given to slow down the process of bone deterioration that can result in bone weakness and fractures. Proteasome inhibitors are a unique class of targeted anti-cancer therapy first approved in 2003 for the treatment of multiple myeloma. The proteasome is an organ within all cells that plays a critical role in breaking down unneeded or abnormal proteins. Proteasome inhibitors work by blocking the activities of proteasomes, disrupting normal cellular processes and prompting the cells to die. Laboratory studies suggest that cancer cells can be more susceptible to damage from periodic proteasome inhibition than normal cells, and this damage typically results in cancer cell death. Sometimes your body's best defense in the fight against myeloma is its own immune system. Immunomodulatory drugs can strengthen the body's own ability to fight multiple myeloma. Stem cells are used to generate healthy blood cells after high doses of chemotherapy or radiation have been given. These cancer therapies destroy myeloma and blood cells in the bone marrow. Stem cell transplantation is a procedure where blood-forming cells, or stem cells, are removed from the patient's or the donor's blood or bone marrow. Certain factors affect whether or not a patient is eligible to have a stem cell transplant, including age and other diseases and conditions the patient may have. For this procedure, the healthy stem cells are harvested from the patient's blood and frozen, while the patient receives high-dose chemotherapy. The healthy stem cells are then transfused back into the bloodstream. Radiation therapy uses focused high-energy beams to penetrate the tissues of the body to reach and destroy cancerous cells. The type of radiation used in treating multiple myeloma is called external beam radiation therapy, meaning the radiation is aimed at the cancer from a machine outside the body. Radiation is often given as treatment for areas of bone damaged by myeloma and producing severe pain, but should be limited to situations when systemic therapy is not effective or may not be fast enough. Surgery is rarely used to treat multiple myeloma, but it may be performed to attach metal rods or plates to help support weight-bearing bones that have or will become fractured due to damage. Clinical trials for multiple myeloma involve studies of new or experimental treatments compared to currently available therapies. Treatments are evaluated with the hope of developing improved ways to treat a disease.